Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all, but sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be.
We're live. And I'm talking. I know. We're live on the Health and Show, an affiliate program of Homeopathy World Community. I must say, every time our show begins now, I get surprised because I'm not pumping up with bouncy music, but all of a sudden my energy settles and I feel calmer and quieter and more in tune, and I know that we're putting our mind and soul and body in place where it needs to be, especially in this really fast-paced, competitive world. So I'm really glad that I changed it, although I feel something is missing without that rhythm. Okay, and we're going to have today with us, returning like the third or fourth time, Phyllis Georgic, homeopath from Pennsylvania, woman of the world, very, very wise, talking about our gentle cell salt, ferrum phosphoricum. And I have brought with me my little library of books, great resources for those who want to learn a little bit more in depth about this remedy. We also possibly will have, thanks, Senya, we will possibly have Dr. Deepak Sharma of the Orbis Clinic in New Delhi tune in via audio, possibly. And Amnon, bring on all of your questions and comments. You always have insights and great stories.
I'll try.
Thank you so much. And all of you listeners out there, all of you viewers, you can call in to 919-518-9773 in the United States or outside of the U.S. Call in via Skype to Computers 2K Voice. And so we are live. How we like to begin? Let me introduce Phyllis. She is a very, very special friend who I have known for probably over 20 years now. And we went to school together with Robin Murphy, naturopath, homeopath, and we have kept that friendship over time. He did teach us about the cell salts, the 12 cell salts at that time. And Phyllis has a lot of experience also with her family and with clients, taking care of them via homeopathy and nutrition, exercise, and all the little tricks of the trade she knows. She's studied midwifery, Tibetan Qigong, and all other kinds of ancient medicinal healing. We're going to mention some of the teachers, like Dr. Ramakrishnan, who is an expert in cancer therapy. She's also studied with David Little, Dr. Iziaga, Will Taylor, and Dr. Banerjee, and many others. So let's get started because we want to learn about ferrum phosphoricum. Why don't you get us up and running?
Okay. Well, we were talking about the fact that in Alan's keynotes, there is no ferrum phosphoricum. And that's because ferrum phosphoricum is a remedy that was actually never proven. And we know that approving is actually giving a homeopathic remedy in homeopathic potency to a group of people and then having them take it when they have no symptoms. And then they report back to the research homeopath all the symptoms that the remedy has created in them. And that's what we call a remedy, approved remedy. Many people don't understand this. I recall, for instance, one of my clients gone to a veterinarian who was a holistic veterinarian, and she refused to use certain remedies because it claimed they had approvings. And she thought that meant that it had, that it was not approved. So she misunderstood the word proving and approved.
So she confused the words approved as approved through some sort of agency, and that it actually works, and what is approving. So
right.
You're saying she was confused by those two words.
Right, and many people are confused by that. So I try to explain what it is approving is. And I myself have done provings, and so there are new remedies that have had provings done on them, like carcinosum concuprum by Tina Smits, and Vernex by Tina Smits, and I know I did a proving with my homeopathic study group of amaranth. We made a homeopathic remedy. We made a tincture out of amaranth seeds and then made it into a 60 potency in our study group. So each of us got to succuss the remedy as we went from one potency to the next. And then we took that remedy and everyone took home with a little log. And they took the remedy 3 times a day and then logged the information. And
how many days did they take it? 3 times a day? They took
for a week, 7 days.
For 7 days, okay.
Mm-hmm, that's all they did. And it was amazing that amaranth is a remedy, or amaranth is a food for strength and for clarity of mind. And it actually made their backs hurt at their spine, like where you would bend down to harvest grain. And it also gave them a headache. It made them feel foggy-headed.
Okay.
So definitely is a remedy for sensation of being foggy-headed and having low back pain. So evidently eating amaranth actually strengthens your back and strengthens your clarity of mind.
Okay, so can I ask you a favor? See if you can pick up your laptop and bring it a little bit closer to you so we can see you.
How's that? Better?
Yeah, that's a little better.
Okay.
Thank you so much.
Sure.
Well, we have a lot of activity on Facebook concerning this particular remedy. There's a quote that I put up there from the master homeopath John Henry Clark that says ferrum phosphoric may take the place of aconite, belladonna, gelsemium, veratrum viride, arnica, and other remedies which correspond to disturbed states of circulation, irritation, and relaxation of tissue. So we had a comment by Aaron Burt Drexel that says, okay, so he's right practically, but his language is obscure. No remedy can ever take another's place. We can substitute ferrum phos, but it will never affect the vital force as the other remedy will, and the process of cure will be different. He continues, this is meant for the trained homeopathic mind. It is folly to think we can replace any of these remedies with ferrum phos and get the same results. Like unto like, not like unto something sort of like. You do not give ferrum phos to an aconite patient if you have aconite, because it does not circumscribe the symptom picture. It will act as partially curative, partially alterative. He apologizes if he sounds arrogant, and he welcomes criticism. So maybe you want to comment on this. And, it seems like the remedies that he juxtaposed to ferrum phos, belladonna, gelsemium, veratrum viride, and arnica, and aconite, all of those have within them some ferrum phos. So what would you say to that?
What I would say to that is when those remedies don't work, when the chosen remedy is not happening, you're thinking this is aconite, this is belladonna. Why isn't it working? It's not working. Oh, let's try ferrum phos. And I've seen this happen many times before. Another time when I was at another seminar in Pagosa Springs, where Robin Murphy used to live in Colorado before he moved to Virginia, he would have a summer school around this time of year, really in August. And a lady had come up who had had a flu. And she was saying, oh, this flu has just drug on and drug on and drug on. And I just don't know what to do. And I said, well, what remedies have you tried? She said, I tried gelsemium, I tried aconite, I tried belladonna. I said, did you try ferrum phos? She said, No. And I said, well, why don't you try it in a 12X? I found 12X will work when the perfect remedy is not working. 12X Ferrum Phos seems to do the work. So why don't you try it? And I would say within an hour and a half, she was feeling tip-top. She was like she had never had any of these problems. And she had traveled from Pennsylvania on a plane, dealing with jet lag and, landing, being up that high, 9,700 feet or whatever, which is, totally too high for a Pennsylvanian to live. I mean, I think our top peak is like 2,500, 2,700, something like that. So she was feeling perfect, and she was amazed that Ferrum Phos did it. And that's, I think, what he was trying to say, that when those remedies don't work, Ferrum Phos is the remedy to go to. And I've noticed myself that Ferrum Phos seems to be the remedy that you choose when there's no other symptom but one.
No other symptom but one. So like it's a one-sided case, would you say, or?
No, not really, because one-sided means one part of the body. No, okay. I mean, you just have a fever and nothing else. Or you have an earache and nothing else. Or you have a bellyache and nothing else. Or a headache and nothing else. Mm-hmm. You have a nosebleed and nothing else.
Mm-hmm. So it's unexplainable. It's unexplainable, and you don't have enough information to go on to select a similimum. I would like to show this photograph of Ferrum Phos. This comes from the Homeopathy, the Principles and Practice of Treatment by Dr. Andrew Lockey and Dr. Nicola Geddes. It's a comprehensive book with common ailments. It's a much-loved book for people who are visual, and so you can see a photograph of this remedy and a little bit about what it's composed of. It's made from iron phosphate. Ferrum Phos is a Schussler tissue salt. Schussler believed Ferrum Phos was most beneficial in the first stages of inflammation, when extra blood flows into the affected tissue and can cause congestion. In such cases, it strengthens the blood vessel walls, thereby reducing the likelihood of congestion. The homeopathic remedy is also used for early stages of inflammatory conditions. So it seems to me that doctors today, especially for autoimmune disease and any kind of injury, and of course the blood, inflammation is the way that the body responds in order to heal. And doctors believe inflammation is the cause of illness, and that's why we are given steroids all the time to stop our immune system and say, hey, no more inflammation, guys. We want to stop that because it doesn't feel good, and it causes this congestion. And congestion is sort of like when the tissues swell up and they immobilize the area. So I guess giving it a chance to heal. But so let's see what you have to say about this most important indication of inflammation for Ferrum Phos.
Well, basically, iron and phosphorus are an important component of foods that we need to be eating. And many of the herbs that are culinary herbs are also medicinal for us. So we have to recognize that we're looking at, in tissue salts we think, oh, they're so gentle. They're very powerful. I really like Ferrum Phos in 3X, 6X, 9X, 12X. I don't find 30C and 200C to be very helpful. I like them in 1LM and 2LM, and I normally don't have to go higher than that to help anyone. So I haven't even made a 3LM or a 4LM, and I don't have any people who are chronically Ferrum Phos. If I have them on a remedy of Ferrum Phos, it's either for an acute situation or it is as a tissue salt they take daily as a dry pellet, or sometimes what they do is I tell them to take the 6X and put it into their water bottle and shake it up and just drink it throughout the day, and every day just replace it, because they're taking it for the reasons of needing iron and phosphorus. And certainly if they're anemic, they need this remedy. But many times I may have this person on the remedy as a tissue salt, and they will develop a need acutely to have it as a remedy. So they will take either a 3X, which would be lower than the 6C tissue salt, or they would take the 12X or even a 9X and use it as a homeopathic by putting a pellet into water, distilled water, and succussing it several times and taking small sips of it or a few drops of it. I've again noticed that 1 LM and 2 LM, which are very low in potency but very deep in action, actually do wonderful work for acute problems associated. And I've used this from infant babies who just are crying and who are just having a fever. They're not crying, they're not cranky, they're not whining, they're not chamomile, they're not calcarea, they're not pulsatilla. They're just have a fever, and mom doesn't know whether she or he are cutting teeth or whether they have an ear infection. And I say, don't worry about it. Don't even think about it. Don't even go anywhere near trying to intellectualize why this is happening. Just use the ferrum phos in the low potency of either 2LM or 6X or 3X in water. And if you don't want to disturb the baby because the baby's asleep, then put it into a spray bottle. That's great. And just spray it upon their skin after you succuss the bottle several times. It's
Wonderful.
It works wonderfully. Yes.
Great, and different applications.
Mm-hmm,
what are you going to say?
Basically, ferrum, the difference between ferrum phos and phosphorus, because we were talking about the fact that we can look at phosphorus and then we can look at ferrum metallicum and combine them. But there are some things about them that are a bit different. For instance, ferrum metallicum and phosphorus both like to drink cold drinks. But ferrum phosphorus doesn't like cold drinks. They like cold applications, but they don't like cold drinks. So that's another key attitude. So they like the cold application on the painful area. They even like cold on tooth problems. So if they have a toothache and they like cold water in their mouth, which is odd. Normally when you have a toothache, you don't want cold in your mouth. That hurts. Mm-hmm. In fact, if it makes you absolutely almost, if heat actually makes you almost pass out, then that's chamomile. So sometimes people think that chamomile is the remedy because they like the cold application, which the remedy actually does have a slight amount of that because chamomile does have iron and phosphate in it.
Wonderful. So, but if you want cold application, I also think for swelling and inflammation, I'm thinking about Apis mellifica. So one of the things that what we're finding in all of the readings, and I have a stack of books here from the masters, is that they're giving us differentiations and some similarities to other remedies to see how closely aligned it is and, how we can use it. So it's really, the definition is not standalone. It's really based on the comparisons of all of these other remedies when it can come into play. Can you give ferrum phos, and I want to make a note that Dr. Kulbashan on the chat said it's also called, he wrote phosphate of iron, and besides phosphate of iron, it's called, it's chemically from iron sulfate, sodium phosphate, and sodium acetate. It's prepared chemically from these other chemicals, which means it must have sulfur in it? Is that true? Iron sulfate?
It has a sulfate attitude because it's a salt.
Okay. So, and also Senya said that she was using it for macular degeneration of the eyes. So, as a support to the constitutional.
Right, so, because it's supporting those small
capillaries.
Capillaries, correct. Thank you for the word. Capillaries within the eyes, and that's where it is. This is a very big remedy for injuries and for bleeding.
Absolutely. That's why we
when you were talking
compare it. When we compare it to phosphorus, which is known for bleeding, and compare it to arnica, which is known for injury, so we can also not forget about ferrum phos. I want to introduce Dr. Deepak Sharma. He is with us, in the video audio.
Hello.
Are you there?
Are you there, Doctor? He can't hear us.
Okay.
Maybe we can't hear him.
Okay, so ferrum phos, as we said, is used at the onset of illness for the onset of colds, congestion, influenza, I would imagine, infections, and especially inflammation, and as you said, bleeding.
Mm-hmm. And also, like I just said, that this woman had several remedies she had tried for her influenza, and it just didn't work, and as soon as she took the ferrum. So it's not just the beginning of problems. It sometimes finishes, or it sometimes will not allow you to go any further until you do it. That's what I think the other homeopath talking about when he says that you can, it's a good replacement for arnica, belladonna, these various other remedies.
That was Dr. Clark.
Okay. Oh, that was John Clark. Okay. All right. Good. Well,
Yeah.
So as a result, and it's true. I mean, if you don't take the remedy that you're supposed to have taken in the beginning, you're going to go back to that remedy. Remember, we go backwards through symptoms till we get back to the first one. Okay. So if they did not take that remedy in the beginning, they're going to develop a crack that's going to lead them down the path of another remedy. Once we get through that remedy, we're going to go back to the first symptom that we had. And if that was a symptom that was ferrum phos, then that's what we should be using. If that was a belladonna symptom, then it's going to go to that belladonna symptom. If it was an arnica symptom, it's going to go right to that arnica symptom.
If the entire symptom picture doesn't clear up with the constitutional or the acute remedy given. It's interesting, as you're speaking, Dr. Andrew Lockey says that the following are helped by ferrum phos. Colds that start slowly may be accompanied by a nosebleed, slow starting fevers, and dry hacking coughs with chest pain. So the indication for the chest respiratory symptoms comes from that phosphorus element. Laryngitis, and I read somewhere for singers who have a laryngitis or difficulty with their throat, we would normally think of something like causticum for paralysis of the vocal cords. Headaches.
Or lachesis.
Headaches that are eased by cool compresses, and that affirms again the desire for the cold application like apis. Earaches, so a child who has a fussy ear. Rheumatism, accompanied by a temperature and shooting pain that recedes with gentle exercise. And this is another one of the keynotes for ferrum phos, the liking for gentle movement, even though I think it does not like being jarred.
No, it doesn't like a lot of movement. It just likes gentle movement and gentle touch. But if it's harsh touch or quick movements or jolting movements, that causes.
But what remedy would
stress.
prefer quick movements? I guess maybe sepia, or is there anybody who wants quick chamomile might want to be bounced up and down in your arms.
Oh, yeah.
So that's how we can compare it. Then for the digestive aspect, it says indigestion with sour burping. Who would have known? Gastritis with vomiting of undigested food, and the early stages of dysentery with blood in the stools. That's another keynote I keep seeing everywhere. And it seems as if the masters are sharing all of these keynotes in their writings.
Yes, Clark has a lot of good information to share. So does Constantine Herring. I love those two volumes, compilations of remedies. I liked reading remedies that were 53 pages and 73 pages of information. I thought that was important. That's the reason why I like polycrests. I use mostly polycrests. I don't go for strange, rare, and the peculiar remedies.
The smaller remedies. They're not confirmed enough for you?
They have to be too specific, and most people are not that specific. But I do find that people of European, like for instance, I don't have a television, so I watch computers, any kind of YouTubes and things. But I also watch television programs from the UK, and it's amazing how there are comedians who do impressions, and they will do impressions of people that, of course, they know. You know, an old lady, a nurse.
The stereotype, Mike?
Right, and these stereotypes just fit in with sepia, nat, myrrh, arsenicum, nux vomica, phosphorus. It's just amazing how they just get into these, and I just find them
You
very
could label them
fascinating.
and use them as examples.
Yes. And this lady that I've been watching, her name is Catherine Tate, Tate, and I remember Tracy Ullman.
Yes, I love Tracy.
Back in the 90s. Well,
what does she say?
Kate Tate is
go
just
home.
like Tracy Ullman. She's just a little bit different, but she's on that same vein. And if you watched Tracy Ullman's characters that she performed, you will see these various extreme expressions of the homeopathic remedies in the polycrests.
Okay, so that's why we love this polycrest, because we can really imagine and visualize that picture of the person. Dr.
Right.
Kubashan on the chat says it's probably this phosphate, which is capable of turning blue, which occurs in the linings of phthisis in bluish pus and expectoration. So, you know, I would think immediately of something like Hepersulf for an infection that has exudate, that has pus coming out, and it's possible the blood needs to be cleaned with the ferrum phos, and he also says it's good for anemia in children. Other areas,
good for anemia in everybody.
In other areas, he says it gives a good result for hemorrhage. That's one of the other keynote things. Hemorrhages, hair falling out acutely, conjunctivitis, epistasis, which is bleeding, and tinnitus. Nose. So ringing in the ears. This is really interesting. The different applications.
When causticum doesn't work for tinnitus, I normally go to ferrum phos. What I've also noticed is that the first symptom that someone will have, that they either have an allergy symptom coming on or a flu or a cold, is they will have burning in one nostril.
Oh.
Around the, just around the, what is the bone in the nose? The
septum?
The septum, right. Right around the septum in one side or the other, mostly the right side, but not necessarily. Sometimes it is the left side. They'll just have this burning, and then all of a sudden a little clear discharge will come out of their nose. Ferrum phos is the indication for that, and if you catch it right away, you will stop whatever this is, whether it's a cold or a virus or whatever. And I also noted that when someone has a lemon yellow discharge from their nose, it's ferrum phos.
Interesting.
Where if it's more green, it's pulsatilla. But if it's this yellow, bright, almost phosphorescent yellow, that's where the phosphorus comes in. But it's the ferrum portion, the iron portion that's necessary also.
Fascinating. I had no idea. So if anybody else has any good hints and tips in the use of ferrum phosphoricum, I also wanted to talk a little bit about the complexion of the person. We know that belladonna, Dr. Deepak Sharma, are you there with us? I don't think, maybe is his sound turned off. Bright red cheeks and face and flushing. So it's also good for flushing, is it not? But he says, Dr. Andrew Lockey says, symptoms include a pale face that flushes easily, a weak and rapid pulse, and chills starting in the early afternoon. So the complexion can give you an indication. And for women, you know, we're talking about the blood. Ferrum phos is given for a short menstrual cycle, dragging pain in the uterus, vaginal dryness, and stress incontinence at night. People who need this remedy dislike, now we're talking a little bit about, whenever you get consultation, they ask you about your foods and your drinks, whether you like it or dislike it.
I talk about it all the time. That's my key note that's going to send me to what remedy they need.
What do you mean? I'll repeat. Go ahead.
What you crave, what you are repelled by, And what you want but makes you sick is the most important portion of taking anyone's case. I don't care whether it is looking at their fingernails, looking at their tongue, looking at their eyes. If you find a craving that they have that's amazingly important, that's the one you're going to go to. And you're going to have to look under those cravings, and sometimes you can get it honed down to 1 or 2 little pieces in it. So there's only 3 or 4 remedies under a particular craving. And that's what you're really looking for. That's the deciding factor for me loads of times, is what they want to eat, what they would eat. If everything in the world were good for them, what would they eat? Mm-hmm. If they are repelled by something, why are they repelled by it?
Okra.
Why don't you? Yeah, why don't you like okra? It's slimy. I don't like slimy. But you eat eggplant and you like that. Well,
yes, I do.
But I wonder why. So that's more of a metarinum symptom.
Maybe they don't cook it properly.
Maybe that's true. But you have to understand that okra is also used as a thickener. So some of us who are not used to eating okra as a food don't find it appealing. In Indian cooking, it is very appealing. In Mexican cooking, it's very appealing. But the people from the United States, unless they're from the Deep South, where they have the influences of either the Mexican population, the Spanish people, they're not going to be interested in okra. But nonetheless, there are certain foods that, if you're repelled by them, like some people will say, I'm repelled by liver.
Yes.
I mean, really repelled by liver, and I love it. But people who are repelled by liver are mostly either ferrum metallic or ferrum phos.
Wow.
Yes.
Oh, my goodness. And that's because of the blood?
That's because of the iron that's in it.
The iron, the blood, yeah,
right.
Well, that's what ferrum phos is supporting the blood cells.
Right, and just like in Natrum muriaticum, you either crave salt or you hate salt. Mm-hmm. Or salt bothers you. It gives you sores in your tongue or in the back of your throat.
Or canker sores.
Right, then you know that's Natrum muriaticum. So if you crave something or you hate it, then you know that's where the symptom picture lies. If they're craving salt, then it's salt. If they hate salt, then it's salt. The same way with the iron. If they hate liver, it's because of the iron. But they need it, and so
what if you love liver? Could it be the ferrum phos if you love it?
Well, if you love it, you just love it. I mean, those aren't that big of a thing. You wouldn't eat liver all day long, breakfast, lunch, and supper for every day of the week.
I'm not eating too much.
Yeah, and there's too much A in it. So as a result, but you do know that in the Gerson diet, for people who have cancer, they support the uses and the eating of raw calf's liver.
Raw what?
Because raw calf's liver.
Really?
Really, yes. You should study the Gerson. Study the Gerson plant.
Raw calf's liver. Okay, I'm just going to mention that since you did mention. Here's Dr. Ramakrishnan and Catherine Coulter are very well known for their homeopathic approaches to cancer treatment. We took his course many, many years ago, and for palliation and support of the individual, he has recommended a section on the Schussler tissue salts here, and I'll just list a couple of them. Calcarea florica, or Calcarea flor, is employed in the maintenance of bone cancer. Ferrum phos he would use for blood cancer. Natrum muriaticum, cancer of the skin. Natrum phosphoricum, cancer of the bladder. Natrum sulfuricum, cancer of the pancreas. And silica is cancer that affects the periosteum. And I just pulled that out so that you know that all the variety of ways that ferrum phos is used. Of course, these shows are educational, informational, entertainment. They are not telling you to take any of these remedies on your own or prescribing or diagnosing anything. I need to give you that little disclaimer. So see your homeopath, see your physician, who may very well be using these. So that's another tip for you.
It couldn't hurt.
And and they're safe.
Yes, it couldn't wait.
And you can see that they are, I don't know if you can see that.
Yeah, we can see that, yeah.
Okay, so they come in these little tabs. These are, they melt. And so usually the pellets are hard. I couldn't crush them. But if I press on this, it would crush and turn into a powder. And if you put it in your mouth, under your tongue like that, it will melt pretty easily, much quicker than the harder sugar pellets. And it says on the bottle, if you look it up, it says inflammatory conditions with heat, redness, and throbbing. When you think of redness and throbbing, we think of, anybody out there? Belladonna.
Belladonna.
Fevers, colds, bronchitis. So we would think of maybe...
Pleurisy.
What would you think of?
Pleurisy.
Pleurisy, yeah, so you're thinking of like lycopodium, phosphorus, but right? Congestion. Now I'm going to pull up another one, but Amnon, you have a question and I'll finish this.
You said that they melt a lot faster than the harder sugar pills. So these are soft sugar pills?
Yeah.
Is that all it is?
Yeah.
They're milk sugar, and they're made in a trituration form rather than in a succussion.
Okay.
And so as a result, they're made to actually be pressed together. The old-fashioned way that they actually, Borky and Tafel was the one who made St. Joseph aspirin for children, and they made it on the same vein as making the tissue salts. They ground it and triturated it.
So the trituration is this grinding process in the mortar and pestle. Right? So that's a good question, Amnon. I'm going to pull up another thing that it says.
And those are just the 6 X's. Now you can, those are the tissue salts. If you find them in 6C, 30C, 200C, 1LM, 2LM, 12X, sometimes they're like that. Sometimes they're in pellet form. It depends. But those normally are the classic method of using the 12 tissue salts that are cell salts, compilated and placed together by Schiller.
Right, and also on the label, it says for toothache. So I have here the textbook of dental homeopathy for dental surgeons. You can see that.
There you go. That's better.
Yep, for dental surgeons, homeopathic. I never heard that one. And general medical practitioners by Dr. Colin Lessel. And he says, and obviously if he's giving this regularly in his clinical practice, homeopathic ferric phosphate, a remedy used in the treatment of acute epistasis, pulpitis, and traumatized tooth with pulpitic symptoms and dental surgical hemorrhage. Again, the bleeding aspect. With regard to the latter, it is important to note the susceptible typology. So that's the type of person: weak, tired, pale, anemic, especially in children and adolescents. So we can see how it can be used that way by both just general public and physicians. He also indicates traumatized tooth. And here he's going to give you some differentiation. Where the tooth is chipped and the dentine sensitive, get the patient to apply Plantago in mother tincture, 3 or 4 times daily, or more often if necessary. Where the tooth exhibits mild pulpitic symptoms, which we said, ferrum phos, 12 to 30. I think he must mean potency C, 3 times daily, a measure which may prevent pulpal necrosis. So we're preventing the tissue from going into deterioration. Where the pulp is actually exposed by dental fracture, he recommends hypericum, 30 to 200 every 30 minutes or more, both before and after pulp capping, until the pain is considerably reduced. So we know hypericum, St. John's wort, is good for the nervous system. And then,
yes, it's actually good in its tincture form to be placed in 1 or 2 drops around that traumatized area. Hypericum, St. John's wort, yes.
And then another big one, so we're talking about teeth right now, where the tooth has been loosened in its socket, give Ruta 6 to 30C 3 times daily, in addition to the other remedies mentioned. So Ruta, we know, is to prevent, what's it called when you have this socket? You had your tooth pulled, and dry socket. To prevent dry socket, I think that I have read numerous times.
Because what it does is it tightens up the ligaments.
Ah, that's really great. Let me see if anybody else has comments in the chat here. Dr. Kubashan again says that these are amazing results. Yes, these are 200 plus years of homeopaths using these remedies, even though they all say the same thing, that they haven't, this particular remedy hasn't been proven enough. Well, it seems like, okay, we're using it and we're getting results. What's going on?
There are a lot of remedies that have no quote-unquote provings, but we use them. I don't think that arsenicum was proven. I think arsenicum was just based upon, poisonings that have been.
That's interesting.
There are certain things that I'm sure that people were just a little bit frightened about proving, even in potency, so as a result, they cared not to do that. Another thing that I wanted to mention is that I have seen that there are a few homeopaths that are actually fearful of giving nozos, like Meteorinum, Tuberculinum, Syphilinum, in low potencies. They still have this belief system from ages gone by, 150 years ago, 175 years ago, that if you give it in a low potency, that you're actually going to give that disease to the person. So there are some people who have I've come across, who've actually been fearful of taking Basilinum or Tuberculinum as 6C because of this, and have, fought with me vehemently over this. I note that the uses of there are some homeopaths who refuse to use nozos altogether because of this fear, and these are very well-known homeopaths who've written books and have big, giant practices in like Canada and things like this. Mm-hmm. But nonetheless, they have all of this negative statements that they make on their websites about being careful. And ferrum phos is a very big tubercular remedy. And certainly if epistaxis is a situation that continues on, and you've given ferrum phos to these people over and over again, and they still continue to have nosebleeds, it's because they have a tubercular miasm, and you better approach that by giving them the low potency of tuberculinum in a 6C, and then a 12C, and then a 30C, depending upon how far you can get them to stretch it. And I'm a proponent of Hahnemannian homeopathy, where you take that potency, that low potency, put it in water, succuss it, and get that remedy to stretch as far as you can. Refill that bottle over and over again without putting another pellet into there, and get as many of those increments of potency between the 6 and the 9 as you can, or between the 1 LM and the 2 LM that you can. And I've noticed really wonderful experiences for people. If the lower potencies are used in frequent manner for, autism, ADHD, ear infections, asthma, heart palpitations, high blood pressure, it's really important that we pay attention to the fact that nozos are a very good and important issue as a homeopath to use, and just using polycrest or those strange, rare, and peculiar remedies is not going to cure a case until you actually get down into the core reason for the disease, and that's miasm. If you read anything about tuberculosis, gonorrhea, and syphilis, the 30, 40 years that an individual might have this disease, they have latent and blatant stages of these diseases, and they're imprinting upon their chromosomes these latent and blatant stages. So then you know what portion of that disease your ancestor had. You don't know how many generations back it was, but you definitely, by looking at your disease pictures or the problems that you have or the remedies that you need in your life, because we all have a constellation of remedies that we use. We are not all cured by one remedy. That's a fact. I have never seen anyone who's just been cured by just the uses of one remedy. So it's very important to recognize that you need to study those diseases, not just what we find in the materia medicus, but go out on we have the internet. Thank God we've got the internet now. I did this when I didn't have an internet. But I studied tuberculosis, gonorrhea, and syphilis, and I found a lot of remedy pictures in there, a lot of remedy pictures.
You went off on a little bit of a tangent to the nosodes and the miasms. I think it's really important for people to realize how important that is, and
Really?
also to realize that each homeopath, even though they may be practicing Hahnemannian classical homeopath, has their own little style of what they found works for them and their clients. Some people will give daily doses, some people will use water doses, some people will do a weekly or a monthly, or depending on the need of that individual patient. So I think that's good to know. Also, I wanted to bring up another little book, because today I'm kind of bringing my library here. It's called Biochemistry. Here you go. Biochemistry, the 12 Biochemical Remedies by J.B. Chapman, M.D., from way back when we were studying it. And here it talks about the different kind of disease in parts of the body, and even mental disturbances, rheumatism, ulcers, whooping cough, etc. And it has a little, what we call a repertory in the back, so that you can look up the different rubric, the different symptoms, to connect it. So right here, I've just flipped through the back of the book, and it says ulcerated throat with fever and pain, and it lists ferrum phos. And so that's another way that you could possibly study. Here's one: belchings brings back the taste of food. Ferrum phos again. So you can see...
That's the sour burps that they talk about.
That's the sour burps. But the way that a person might indicate it or speak about it, it helps you to know how to look it up. One of the other things that I wanted to bring up, because we've talked a lot about inflammation, it says symptoms of these disturbances are, again, flushed face, fever, quick, full pulse, hot, dry skin, thirst, pain, and redness of the parts. So here it does sound exactly like belladonna, except we think of belladonna most usually as being thirstless. So here you have all the picture of belladonna, but the person is thirsty. So that is another really keynote indication when we ask, is the person thirsty or not thirsty? Is the person warm or cold? Does the person want hot or cold applications to feel better? It may not get rid of the symptom, but it comforts them. So that would be palliation.
And also, ferrum metallicum, their look is very rosy-cheeked. They have an exceptionally rosy cheek and face in and around this area. Whether they're hot or whether they're cold, they look like the proverbial little Dutch boy or little Dutch girl with that rosy face. And that's ferrum metallicum. They also have very red ears. All of a sudden, their ears will just get red and hot. For no reason.
So that makes you think maybe about sulfur with the red ears, and red complexion.
Right, but sulfur normally has red around the mouth, around the nose, around the eyes, an orifice that has a discharge, where when they have this other redness in these areas here, this is more of a peripheral area like your hands.
Okay.
And this is kind of like a way that your body is releasing its inner core of temperature. And ferrum metallicum tends to have that symptom. But sometimes you note that the pale and the flushed symptom is a ferrum phos, because phosphorus will have that. Phosphorus also has issues with the sunlight or even daylight they're the people who walk around with sunglasses on indoors.
Who are you talking about now? Nature muriaticum?
Phosphorus.
Phosphorus is going to walk around with sunglasses on indoors?
Right.
What about
Right.
Nature muriaticum? I thought they're the ones that have a problem with sunlight.
They can, but the phosphorus symptoms are more predominant under photophobia.
Okay.
They also have a very airy-fairy kind of look to them. They kind of look moony. They kind of look like they're always off in the etheros.
What is that? A little spacey?
Yeah, a little spacey and off in the etheros, and they're always talking about the spirits and your spiritual energies.
Oh, this is ferrum
That kind of
phos?
stuff. That's a ferrum. That's a phosphorus.
That's phosphorus.
That's phosphorus.
So
the iron in the phosphorus, when you have a ferrum in the phosphorus, brings that airy-fairy attitude back into a grounding sensation into this area.
Okay.
And into the solar plexus. So they will have these. This might be a phosphorus person, constitutionally or fundamentally is what I like to call it. I don't like to call it constitution.
Uh-huh.
That doesn't really, it's not it. It's fundamentally, because we change our fundamental attitudes. So fundamentally, this person might be a phosphorus, but at some point or another, when they go into some kind of illness, like a pre-flu or a pre-cold or that burning in the nose portion that I was talking about, with a little discharge of water or something that's kind of slimier, that could be the ferrum phos in them. So it's their phosphorus nature trying to bring them back down into their bodies again, instead of floating around in their third chakra or whatever way out here.
So but can I ask you a question? What about the kids who have that like ring of red and they're licking their lips a lot and maybe even around the nose? What do you say for that?
That's either a ferrum, that's either a hepar sulfur, which is calcium sulfate, or it's a natrum muriaticum symptom.
Oh.
They're very dehydrated.
It's dry, it's cracked, it's this like red, and it's really irritated, and you want to.
You see these kids doing this all the time.
Yeah,
and that's because they're constantly dehydrated, and dehydration is natrum muriaticum, natrum phosphoricum, natrum sulfuricum,
natrum arsenicum.
Yeah, natrum arsenicum. Yeah.
Yeah.
Mm-hmm. Yeah.
Amazing. I of course, each person needs to have a full case taken, because I've seen this also for plant remedy. And the plants also contain all of these chemicals. So
that's right.
So, it's not necessarily just the homeopathic biochemics, but it could be a plant that contains some of these elements.
And that's the reason why we study these. And the most important portion of being a homeopath is to study your materia medica, not to study your repertory, not to piecemeal symptoms together, but to study the whole remedy so that you have an understanding of the remedy, plus the fact that you may need to have some little nuance throughout the case that's going to guide you to one remedy or another remedy. And that's how we work as homeopaths. That's how you hone your skill as a homeopath, as you learn the biochemistry of things. So.
Dr. Kubashan said a little bit earlier that it is infallible in urinary incontinence of the elderly, where the urine spurts out with every cough. Of course, there are many other remedies for that. Urinary
Natrum muriaticum.
Natrum muriaticum also? Again, causticum,
right.
I think about. Nux vomica has that?
Yes,
okay, there's probably at least 50 to 100 remedies that have it, but it's a very gentle acting. Dr. Kubashan also adds ferrum phos corresponds in many ways to bryonia. Yes, it does. Belladonna and arnica. And I'll tell you, Catherine's asking about allergies to plants. I'm going to read one little quote, and we only have 3 minutes left to the show. Okay. This is an incredible book.
I love it.
Okay, you look at this. This is a big book. Yes. This is homeopathic, a good doorstop. Which you
you use this book as
kick
much
it
as
open and take a look at it. Homeopathic drug pictures, a materia medica of 125 homeopathic drugs and their correspondence to patients' environmental, physical, and emotional reactions with black letter symptoms, written by Dr. M.L. Tyler. Awesome author. And she says that the last piece in her six or seven page compendium on ferrum phos in here, it says, ferrum phos is a constituent of China, which is cinchona bark, right. Gelsemium for like chills and influenza, fears right. and anxieties, veratrum, and he says here veratrum, I assume it's veratrum album, even though Dr. Clark right. said veratrum viride. Aconite, white hellebore, right? And aconite, which is also a panic remedy, an anxiety remedy, an initial symptom remedy, happens quickly. Although ferrum phos, it seems to be slow starting. Okay, arnica for the bruising. Ailanthus, Ailanthus. Tell me a little drop about that.
Ailanthus tuberosa, or Ailanthus.
I don't know if it's in here.
Oh, it's basically part of the sumac. It's called
sumac.
The tree of heaven. Okay. Ailanthus glandulosa, or Ailanthus. Oh, I can't remember the other name for it, but nonetheless, it's basically it looks like a tropical tree. It's associated with sumac and with black walnut. It looks very tropical, but it grows in the northern climates.
It's probably a lesser known remedy. It's not in Alan's keynotes.
No.
And then there's one, ANIS. Is that anise? I'm thinking ANIS. Anise?
Yes.
And then still, STIL, Stilago?
Yes.
Yes. And Phytolacca, Berberis, Rustox, Asafoetida, Viburnum. I have a beautiful one of those plants in my yard. Cicale, Graphites. So he says Cicale has 25% of it is ferrum phos, and Graphites is 2.74. Oh, 0.25% is in Cicale and 2.74% in Graphites. And she is citing Berikey. So you can see the complementary or the similar or dissimilar aspects and way these remedies would act. We have come to the end of a whole hour. I have a feeling you could even do another hour on ferrum phos.
Oh, sure. I mean, there's lots of remedies. There are a lot of compilations of remedies in these remedies made from various kinds of hot springs, Lourdes water, Gettysburg water. I mean, they're loaded. You can't imagine how many chemicals, lithium, arsenicum, ferrum phosphoricum, sulfuricum, that are in there and that actually have done great healing for people and certain people who've gotten into these waters. Skookum Chuck.
Okay. I want to let you know that in about an hour, there's going to be a brand new show on this. It's an old show that's moved to a new hour with Marilyn Shannon at 1 p.m. She's going to have an awesome group of people talking about a journey they're taking and how they met on Craigslist. So we really people meet in all sorts of strange ways. I even saw one of those talent shows where 3 men from 3 different continents got online, met each other, and said, "We want to be on this talent show." And they were awesome and totally surprised. They came in their like junk clothes. They weren't dressed up. They'd never met in person before, and they were all opera singers. And they just stunned the crowd because, we can meet anywhere online and form a friendship, form a collaboration. Right. We're ferrum phos. I don't know. Yeah. We're iron, strength, and phosphorus, little sparks of light. Next week, I think it's going to be me. I'm talking again about faith in homeopathy. Bring your stories. I appreciate all the comments that we've had so far today. And I'm not going to have a show on Wednesday on Blog Talk Radio, but we will be live on Blog Talk Radio Thursday at 1 o'clock with Greg Glazer, constitutional lawyer from California, and Alan Phillips. So I invite you to that. Do you have any things that you want folks to know about how marvelous Nissan Communications Network is?
No, they already know.
They already know. I would like to say, if anybody would like to have a banner, we have the opportunity to do that, to be a sponsor, to help this network grow and disseminate the information further. And, you know, you might have something that you want to get out there too. We have probably, I know, up to 2,000 or even 3,000 people on a show listening or viewing the show. And I know on Sunday you have 10,000 to 15,000 people who could learn something about homeopathy, something about ferrum phos or the cell salts. You know, this is our opportunity to connect with some more people. So we would love that. Thank you, everyone, and looking forward to seeing you next Monday back here on the Health In Show. Sending waves of awareness and lots of love. Thanks, Phyllis.
Thank you, Deb. Thank you. Appreciate it.
Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place.